Hey, Dr. Drew here with Inspire Aesthetics. It's another edition of the long-awaited Inspire Chalk Talk. So I'm going to talk a little bit about breast augmentation versus breast lift with implants. So in a straightforward breast augmentation, usually the proportions of the breast are pretty reasonable. They can be a little asymmetrical, but overall the breasts are in a reasonable position, and the nipple areolar complexes are at a height which is normal, which means that they're projected anteriorly and not pointed down or falling lower than where they should be. So typically in an average female, a distance from the sternal notch to the nipple is somewhere between about 19 and 21 centimeters. And generally that's an average setup for a person who has a normal healthy breast projection. And they're generally a candidate for a regular breast augmentation, and that set of implants could go under the muscle, it could go over the muscle, or it could be dual plane and go partially under the muscle and partially under the breast tissue. So there are reasons for those different techniques. The safest place to put an incision is a 4 centimeter incision at the inframammary fold. There's a lower risk of capsular contracture and a lower risk of infection with that incision statistically. However, we can put incisions around the nipple areolar complex, up in the axilla, and if we're using saline or saltwater implants, we can even put implants through the umbilicus and make the tunnel for those implants in reverse. It's my least favorite place to put implants or access. So that's a breast augmentation versus a breast lift. Now a breast lift, you can see here, there are different stages of ptosis or lowering of the breast tissue over time. That could be purely genetic. It could be from weight gain and weight loss. It could be from pregnancy and breastfeeding. There could be all sorts of reasons why breasts are low. Now, when we put our hand behind the inframammary fold and there's a crease or this fold that where the breast falls over and a natural crease or break in that fold, when we put our hand behind here, that's generally where the nipple areolar complex should fall. It should fall somewhere at or above that inframammary fold. And if a breast is way down here and this distance is well over that 19 or 22 centimeters and maybe more like 25, 30, 35 centimeters, that's when a patient needs a breast lift. And with a breast lift, it's a more complicated procedure. There are several ways to do a breast lift. The most common one is called a Wise pattern, and that incision goes around the nipple areolar complex, down to the fold, and across the fold. So that incision looks like an anchor shape. A lot of people are afraid of that incision and say, I don't want all those scars. Generally, they heal very well. And over time, they generally hide very well. We're able to lift the nipple areolar complex back into position and make them equal. And we can do that with or without breast implants.